If you're a young adult with multiple enlarged lymph nodes on one side of your neck, then ultrasound imaging can provide key insights into your condition. The ultrasound typically reveals irregularly shaped lymph nodes, varying in size and texture, with some areas appearing darker or black, indicating possible necrosis, or cystic changes. The fatty hilum, usually visible as a brighter central area, may be preserved in some nodes, but absent or displaced in others, depending on the underlying condition. Color Doppler imaging further illuminates the situation by showing varying degrees of blood flow within these cervical lymph nodes, while some nodes exhibit moderate internal vascularity, suggesting they are reacting to infection or inflammation. Most nodes present with poor vascularity, indicating a less active or more chronic process. The blood flow pattern in vascular nodes can be central, peripheral, or mixed. Based on these imaging findings, several possible diagnoses may be considered, including reactive lymphadenopathy, tuberculous lymphadenitis, lymphoma, or metastatic lymphadenopathy. Each of these conditions requires different approaches in terms of prognosis and management. Reactive lymphadenopathy, commonly due to infection or inflammation, often resolves with treatment of the underlying cause and has a good prognosis.
Tuberculous lymphadenitis has
a favorable prognosis with appropriate treatment, but long-term therapy and follow-up are necessary. The prognosis for lymphoma depends on the type and stage, with early detection leading to better outcomes. Metastatic lymphadenopathy typically indicates advanced disease and carries a more guarded prognosis, depending on the primary cancer. In terms of management,
strategies depend on the underlying diagnosis. For reactive lymphadenopathy,
the treatment involves addressing the infection or inflammation and monitoring with follow-up imaging. For tuberculous lymphadenitis, anti-tuberculous therapy is initiated with regular imaging to monitor the response. In the case of lymphoma, confirming the diagnosis with a biopsy and proceeding with chemotherapy, radiation, or both depending on the type and stage, is essential. Lastly, for metastatic lymphadenopathy, the primary cancer needs to be identified and treated accordingly with surgery, chemotherapy, and/or radiation. This comprehensive approach ensures that the appropriate care is provided based on the specific imaging findings and diagnosis.